Welcome back, Bravehearts. Anyways, this is Dr. Darryl Wolf. I'm on DocStar TV, and this is Dr. Gary Fong, and we'll be bringing him on in a second. And I'm going to tell you something. What an honor to have him. He is one of the most renowned specialists in the area of IGF1. And a lot of you are going, IGF1 what? IGF1 what? And I'm going to tell you something. I didn't learn about IGF1 until 3 years ago, and understand this. If you want to talk about hacking vitality, hacking youth, having strong bones, okay, building up your immune system that your fighter cells can protect you better, okay, having, how about this, a product that builds collagen faster in the body than anything else, having a product that will give you sustainable energy all day long. Okay, so here's my secret, right? Oh my God, Dr. Wolf, you have so much energy. Well, guess what? This is my IGF1 right here, guys. It's actually our product. And this is an IGF1 that's not made by anybody else, and you'll find out by the end of the day. And yes, guess what? There are IGF1s out there, and guess what? They're synthetic. And we're going to find out what a synthetic IGF-1 does and what's the difference with the one that the Doc of Detox makes, okay, with the help of Rick, the formulator, and Dr. Fong. I mean, there's no going wrong. And understand this. I take mine, it says on it 3 times a day. I take mine 4 and 5 times a day because you can't OD on it. It's just this. I'm going to let him speak because he's the professional. He's way more smarter than I am. He's one of these academic techie guys, okay? And the reality is this, okay? Remember when you were younger and you could go out and party? And then you could get up by 2 o'clock and start rocking your day and go out and party again that night? Well, guess what? The only reason why you got away with that was IGF-1. It gave you your fun. It got it done. And the reality is here, are you ready for this? Human growth hormone goes into your liver and makes IGF-1. It's not the human growth hormone. That's the holy grail secret. Nobody gets this. Go ahead. Go get your human growth hormone shots. Go ahead and see how that works. Why don't you go and buy that really expensive human growth hormone product and see how that works? Or use IGF-1, no side effects. Oh, and guess what? Guess what? It scares the crap out of Big Pharma. Because I'm going to let Dr. Fong talk about it, but guess what? They tried to come after it and they said that it's banned for all sports people. Meanwhile, the IGF-1 here is the same IGF-1 that your liver used to make when you were kicking butt, when you had energy, when you felt youthful, when you had no problem loving life, making love to life, and life making love to you. And that was the deal. That's the deal. So Big Pharma says it's banned and sports people can't take it. But if they do take the IGF-1, it doesn't show up as anything except the liver makes. So it's like, nah, what are you going to do now? And the reality is they might not like this, but they can't stop it. It's all natural. And the reality is when the top people in sports, I mean this, in the professional sports field around the world, started using this product, okay? All right, they got their bun in a knot. And I'm going to let Dr. Fong just talk about a whole bunch of stuff, and we're going to kick this off. And the reason why, as I already told you, I'm going to bring on all of the chemists, the scientists, okay, the people that have produced my products. And I did say this just an hour ago. I don't have the most products in the world, but I have the best products in the world, and I will go up against anybody on that one. Anybody. And if they're not the best, tell me, and I'm going to go get it. But I know that I do. I've spent 44 years searching out the best products. Not, let's get a whole bunch of products. And understand that. But the best products. Okay? All right? So, Dr. Fong, it's an honor to have you here.
Well, Dr. Wolf, it is a pleasure to be here again, and I really appreciate the opportunity to speak on your behalf. By the way, my first name's Bruce, not Gary, but everybody
You know
calls
what?
me.
I did that before too. And can I tell you why? Because I have somebody who works with me in my business, and his name is Gary Fong. So I know your name. I know your name. I apologize.
I have a cousin named Gary I love very much too, so that's why, no offense at all.
Do you remember that I did that about 2 years ago?
Uh-huh.
Okay, all right. So here we go. Okay.
But okay.
I'm going to need more of my CIT product because of my dementia. Okay. So why don't you tell everybody who you are and where you practice out of, please. And a little bit about your practice before we start. Because those people who come and go, I want them to know about you, okay?
Right. Yeah, so my name is Bruce Fong. I'm actually a integrative internist, and I graduated from osteopathic school in 1997. In fact, that big diploma behind me is what that is. And I did a rotating internship in Florida, and I actually did a 3-year internal medicine residency in Las Vegas. And I've been in practice in Reno, Nevada since 2001, offering what we call integrative internal medicine. That's where we delve deeper into your problems and beyond just your conventional workup and treatments. We basically look at even more of an integrative side of things, meaning alternative approaches to both a diagnostic arena as well as for treatment. And one of the things I see a lot of are patients with typically chronic neuromuscular diseases, or we've seen a lot of patients with chronic Lyme disease. And one of the things that helps my patients recover after therapy is this product we're talking about, is the IGF1. And again, IGF1, as we're talking about here, is actually not just the insulin-like growth factor 1, but we're talking about a complete growth matrix that comes from deer antler. And again, deer antler is something in traditional Chinese medicine that is used only second to ginseng, meaning that every time a Chinese traditional herbalist mixes herbs with you, they almost always use deer antler.
Deer antler.
Yeah, and so brings back a little memories from when I was a kid. I was this little 5-6-year-old little guy, and my grandparents in San Francisco, we had to walk over these really big hills to get to Chinatown. And of course, this is why we never got sick, because, oh my God, Grandma and Grandpa are going to drag us to the herbal store. But I realize now that experience actually really enriched my life. It allows me to have a really great perspective on why we're so passionate about using deer antler. And the ancient Chinese knew about deer antler probably 3,000 plus years ago. And again, it's what we would call, in a more modern term, a more constitutional remedy, meaning it's the thing that helps to build you up, a thing that helps you to, in more modern vernacular, shut down your inflammation, help your body to actually heal, and actually to even maintain your body at its optimal level. And the ancient Chinese knew this by strictly observational approaches. And here we now are, come back to the late 20th century. We've discovered it's not just deer antler itself, but it's the deer antler velvet. So let me explain what that is. Every year, deer, in case you don't know this, lose their antlers. And then basically every year they grow a whole brand new rack in the springtime. So if we can actually, bring about the antlers, we'd be actually at the middle of the growth cycle. So it's 110 days to grow a new rack. And if the antlers are harvested at about 55 days, the inside of the antler is this active matrix. It's a gelatinous, mushy brown thing that, if it dries out, becomes very shiny, and that's what we typically call a velvet.
And sir, doctor, if it's okay if I say this, because
yes.
If you get this, everyone, we want you to understand this and make it perfectly clear. These deer have no suffering, no pain, nothing when this is done. So I want to get that out of the way, because there's always people that come on here, animal activists, and think that Dr. Wolf is doing something. We are not harming them at all. They are treated like royalty. Okay? All right. Thank you.
Yeah, the herd of deer that's specifically used for at Neutronics Labs, which I represent, they're out of New Zealand. They're completely organic, and it's just they're tranquilized, I believe, just through their food. They fall asleep, and then the antlers are surgically removed, leaving a nub so they can continue to grow antlers in the future. And basically, the deer wake up and, well, they don't have their antlers, but otherwise they're completely happy. They're fine. They're frolicking. That's actually pretty cool looking. In case any guys are worried about that, there's absolutely nothing to worry about. The deer are very happy, and we need them to be healthy and happy so we can get the greatest of these compounds, these growth factors. So
and if I can say something just for a second, and if everybody understands, is that the Doc of Detox IGF1 is a very special formula, isn't it, Gary? And I want everybody to get this too, is that when we're dealing with patients with stage 4 chronic illness, okay, when we're dealing with what we were able to actually, with the IGF1, okay, be able to do what's called advanced water fasting. Everybody does water fasting, but if you do water fasting, you can go through hell, because what happens is when you use IGF-1, it bypasses the Krebs cycle, doesn't turn on the digestive tract, and it formulates energy in the body for the body to detoxify without going through a struggle, and to have energy so that you don't get laid out. You know, we have we have 6 main products that we use for advanced water fasting, this being one of them, that people have never done fasting before can go anywhere from 6 days all the way up to 60 days of fasting on these 6 different products, and they do not go through any crises. And we have shown that the stem cell making, okay, is quadrupled compared to just water fasting, because of all the energy coming in without turning on the digestive tract. That's the way it always is. And understand this, and I think, and then I'm going to throw it back to Dr. Fong, but we have had people, okay, here's the thing. Sick people can't get out of bed. Sick people don't have the energy to move. Whether you want to believe this or not, this is one of 6 products that we use, and we'll have people, and Dr. Fong, maybe you don't experience this, but between using my IGF, my calcium ion therapy, my C60, my Omerous minerals, and thunder shrooms that are from Asia, we have people that are sent to hospice, and within days they go home, Dr. Fong. And the IGF, okay, remember something, when you have no energy, how much fun are you to be with? When you have no energy, most people would call that depression. And how do you get somebody out of depression? You give them back energy. And if they can't get their own energy back by smiling and believing that life is beautiful, then guess what? We have to inject them, believe it or not, with lots of IGF-1 to create the energy to go, what is that? That's a feeling of life. Dr. Fong?
Yeah, so again, the IGF itself is IGF-1, insulin-like growth factor 1, which is the principal component of the deer antler velvet matrix. It is the principal thing that's created, that I believe you mentioned earlier, by the liver from the presence of human growth hormone. It's the principal motivator of all the effects there. You repair stuff faster, you break down inflammation, you create energy, like you said, and you, in general, remodulate the body, the metabolism, to what it was supposed to be at the optimal state. And again, I can't say that even any better than that. You are trying to restore your optimal state. Remember, traditional Chinese medicine is about balancing the yin-yang, the 2 opposing forces. And again, to achieve this optimal balance, you need the IGF-1 in there.
Can I say something? People will actually say to me, Dr. Fong, oh, what did you do to your face, Dr. Wolf? Are you getting some facial work? Okay, I got to tell you something, everybody. This is one of the major products, because Dr. Fong, this creates more collagen in the body than any other product, doesn't it? So what do you think it's going to do to your face? It's not my fault it works.
So other than the IGF-1 itself, we've got actually the deer antler velvet itself actually is composed of a lot of collagen, but it does produce in the body an effect through the various growth matrices the growth factors that make up the matrix, to a stimulation of collagen production in the body, and more importantly, where to lay that collagen down properly for reparative and or maintenance issues.
So we have Dr. Fong on today, and he's going to be coming on about another 3 or 4 times in the next 2 weeks. Well, because that's the Black Friday sale is going to be running for that length. But I want everybody to have a chance to it if they haven't never experienced it, because if you buy it, you're not going to stop. But I want everyone to be able to experience it. So today we're going to talk more generally about it. But if you take a look and go to DocStar, okay, TV guide, and it's on docofdetox.com, docofdetox.com, and you'll see all the other times that Dr. Fong is going to be coming on. Okay, go ahead, Dr. Fong.
So we'd love to talk about all the different effects. I mean, literally, the deer antler velvet extract, as we call it, is which all of us typically call an IGF1 plus product, because it's primarily IGF1, but it's got typically about 13, 14 other growth factors in there. A lot of them are specific for things like, for the skin and the soft tissue, like we mentioned. We have bone factors that can help, neurologic factors that can help regulate and repair things there, things that help with the circulation, things in particular. The main claim to fame of the IGF-1, it was for increased stamina, increased performance, and really the ability to be the best you can be, whether it's athletic or otherwise. And again,
a mother, a father, working, sports, it doesn't matter.
Absolutely.
Mind work.
Exactly.
It'll bring you right back within minutes.
Right, because the IGF-1 itself, being the main motivator of human growth hormone, also, believe it or not, will regulate other hormones in the body. It regulates your immune system, reduces inflammation, so you can actually repair things. Yeah, I mean, let's face it, everybody, when you work out, you're actually technically traumatizing yourself to build yourself up and build up more stamina. That's what, when you're putting on, some bulk, if you're doing resistance exercise, the IGF-1 optimizes that situation. So it helps not only for you to have a stronger and better workout through everything from better blood flow to better nutrients to the actual fibers of the muscle, but it also, because of the, if you want to call it the relative damage of working out itself, it helps to repair that faster. So guess what? You lay down new muscle faster. You expand the fibers of the muscle you have already. In other words, it helps you to get those gains a lot faster. So first question should be on your mind: is this a performance enhancer? Well, guess what, guys? It is nature's way of making sure you're the best that you can be. That's the way I always love to say it. The term performance enhancer, yeah, technically it probably is that, but it's got a negative connotation. You've got professional sports leagues that try to ban IGF, even though it's a naturally produced compound in your body, and you do somebody's blood tests, well, they're always going to have some in there. So how can you really tell if you're really using it or not? But I can tell you for a fact there are various athletes that I know of and who will remain nameless who have used this, who are very, say, prominent in their particular sports. They do extremely well. They're the ones that everybody says, wow, I could never be like that person. But guess what? You can be like that person, because you are taking the same thing to optimize yourself, to bring you to the best you can be. And it's not like steroids, it's not like other harmful drugs, because it's natural. It's meant to be in balance with your body. Remember, we're achieving the optimal balance to allow your body to be the best it can be, but not take it to a point where it's harmful for you. And again, this is the most critical difference between using this particular compound, the deer antler velvet or IGF-1 pluses. All of these particular compounds are going to make you the best that you can be, and not take you to beyond where, say, genetically your body is supposed to be limited. Again, we're not trying to create super soldiers. We're not trying to create monsters. We're here to make you the best that you can be. Not only feel the best you can be, but to be able to fulfill life to its fullest.
So, Dr. Fong, if I can say this, and just so you understand what he was meaning, okay? And that's this, is that it's not going to stimulate you. It's not going to stimulate you like a cup of coffee. It's not a drug. Honestly, it's like this. You feel yourself rising, and then you just stay where you go, wow, I used to feel like this. and then you don't come down like this. You don't even notice yourself coming back. And the reality is, believe it or not, the longer you take this, the better this works. And if you stop taking this, the effects wear off and you're back to square. You know, people think I'm crazy, but I make up my own stories, just like everybody made up stories hundreds and thousands of years ago, and now people just go and they just do them. And I'm telling you right now that we were actually programmed to lose our human growth hormone, and that was the dirty trick. And this is hacking the dirty trick that they pulled on us. So the human growth hormone turns into IGF, and I get to keep my vitality. I get to keep this extra energy. I don't have to act like, do I act like a 67-year-old guy going on 68 right now? That's not happening. It will never happen. You know what? I know too much. It's like this. Okay, just say this to yourself. Scientifically, what did I have when I was on top of the world? What don't I have now that makes me feel low, that I can't keep up, that I don't participate in life? And we know how to replace that. And I'm not kidding you. If I can replace what you've lost, then there are no cures. It's just called harmonizing, bringing you back into alignment. Dr. Fong?
Absolutely. And so everybody out there, everybody talks about, hey, I hit my 30s and holy crap, I went down. Oh, I'm sorry, I shouldn't have said that word. But anyway, the bottom line is that everybody says, what happened to me? I hit 30. Hey, my metabolism slowed down, or I don't have the energy. I can't work out as well as I want. Guess what, guys? That's when your IGF-1 production in your body starts to go down to the point you feel it. Even when you're born, you probably have the most you have. And eventually it kind of gradually gets less and less throughout your life. And then ultimately you hit a certain point. Most people, it's in their 30s that you start to feel it. You don't have the stamina as much as you used to. You can't recover as quickly from
You start putting on the weight, eh? You start putting on the weight.
Exactly.
You start getting the wrinkles.
Yeah, exactly. And so that's the beauty about, just like what Dr. Wolf was saying, is the fact that you can actually help to restore this. It's completely safe. It's completely natural. And by the way, I know some people are out there going, hey, unopposed IGF-1, aren't you worried about cancer? Well, yeah, it would be, except that the complete growth matrix that this deer antler velvet is contains growth factors that actually prevent the formation of malignancies. It actually checks abnormal cells before they can be formed or establish a foothold, so to speak.
Yeah, people, can I say this? People,
Yeah,
you've gotten your information from those who actually try to market synthetic IGF-1. Synthetic. There's the difference. Can you tell them?
So, again, the products that we talk about here, of course, are strictly, it's just literally taking the deer antler velvet, taking the inside, cold pressing it, and putting it into a liposomal delivery system, which is critical, which we'll talk about later. And that's all there is. It's pure stuff. When you create synthetic or semi-synthetic growth factors, hormones, remember, endocrinology is the most intricate part of medicine. It's the thing that you have to understand, that for every action, there's not just one opposite and equal reaction. There's a whole series of cascading reactions that are related to the one thing that you try to change. And again, by saying that, when you put something in there that's kind of fits in the keyhole but isn't quite the key that you're doing, if it turns the lock, that's great, or turns the ignition, that's great, but guess what? You're damaging stuff along the way because it's not exactly the way that it was meant to be. It's not the way that God had put that there in the first place, and it's going to potentially have some type of unwanted so we say side effect or effect down the line that we weren't expecting. So I would never recommend any of the stuff that's semi-synthetic that's out there.
Absolutely. Absolutely. All right, so I hope you're getting it, everyone, that, and some people say, well, it's not affordable for me, but you know what? We have priced this at the best price point, and guess what? Right now, if you want to try it out, we have our Black Friday sale on it. It's the best price it's going to be. And Dr. Fong, can we talk about what the long-term effects are? Like, I mean, you can take this for life, right?
Absolutely. I think that I would recommend everybody be on some of this, especially if you're past the age of 30. And again, We have, at least from where I'm, again, representing Neutronics Labs, we have various different doses. And I know, Dr. Wolf, you have various doses for everybody from different levels of
Yeah.
activity and lifestyle. So you can start with the most basic level that you start out with, and you say to yourself, okay, this is for somebody who just wants to maintain themselves, who wants to get the most out of they can, who doesn't get very active. Then from there, you increase the amount of the IGF-1, the concentration for the people that want to get more and more active. My personal feeling with my patients who come to me who are technically, they're, I don't want to use the wrong term, but they're technically kind of destroyed. Their whole bodies are beaten up by Lyme disease or whatever else, and we get them cleaned out. But just like you said, Dr. Wolf, that's not the end of it. You've got to help that body to recover. And one of the critical ways of getting my patients to recover is, again, the IGF-1 plus products, and again, the Deer Antler Velvet product, if you will. And so, again, it's critical for whatever situation that you are using it to utilize it for that situation. And honestly, just like you said, we in over 35 plus years of clinical experience, and we've never seen really any ill effect from this. We've seen nothing but benefits in people.
Yeah, and can you tell people the difference between the 25,000 and the 300,000? I take the 300,000, but we have one that's 25,000, and you can start by following the dosage on the bottle, but you can take more. But could you just explain it to them?
So pretty much what we were saying earlier, you want to start. I'm a firm believer of using the lowest effective dose possible. So when we say there's 25,000 nanograms, now a nanogram is 1/1,000,000th of a milligram. That's how small this is measured in. You don't need very much of this stuff. The whole point is 25,000 nanograms is again, that's if you calculate it, I'm not great at math, sorry, but again, that's a very small fraction of a milligram. And that's the whole bottle. That isn't like one dropper full or a drop. That's the whole bottle there. So then you go. So that's typically a dose that a lot of people start at, just for maintenance, to help them feel the best they can feel. Well, typically, those folks are not very active. They're not, hardcore working out. And then we have people who are all the way at the other end of the spectrum, which is at 300,000 nanogram in the whole bottle. And those are the folks that are typically the hardcore athletes, the ones that really want to get that extra.
Or I'm not a hardcore athlete, but I'm a hardcore, let's take on the biggest projects and travel the world. Like I'll tell you right now, I just did 8 months of traveling the world, and we have another 8 months. We're doing a world tour on our lectures, free lectures and course trainings, right? I wouldn't do without it. And I couldn't do without it.
You're an educator and you're a doctor. That you're doing God's work as far as I'm concerned. And then the whole point is that you need to be the best you can be. When you're under high stress, that's another way of looking at this. When your body's under a lot of stress, you probably want to have a bigger dose. And when you're doing that, you're going to maintain yourself that much better than especially compared to a person who's not using it at all, but even compared to a person who might have a lesser dose who's going through the same or more of a stress than you are.
I hear you. All right. So we're going to be having you back on. I just want to take a look here and let people know when you're going to be coming on. Let me see here. I'm trying to get it. Lori, do you know how to work this? Can you remove this? So this afternoon, while we're doing that, this afternoon, I'll be back on at 2:30 Eastern Standard Time. I'm going to be talking about energy medicine, light therapy, and Tesla lightwear. Guys, these are the only glasses that will really help you with blue light, but we'll talk about those later. I want to talk about Dr. Fong. So let me see here. I need this. Okay. We have Dr. Fong on again on the 16th at 1 o'clock. And then the 17th, okay, again at 1 o'clock. So if you have questions, we haven't had any questions today. I know it's Monday. But if you do, I'll be watching for them. And we will be talking about different subjects. like IGF1 in women, IGF1 in athletes, IGF1 in children, IGF1 in the elderly. What other topics will we be discussing, Dr. Fong?
So we've got all kinds of different effects that the IGF-1 can help us with in the body, and certainly we can even talk about the reduction of inflammation, the modulation of the immune system. We can certainly talk about just simply how IGF-1 is the greatest maintainer of our bodies, and literally that's one of the more general things you can say, but you can't say enough about it. It literally is the main motivator. It's the ultimate, I hate to use the word anti-aging, but the ultimate tool to healthy aging, healthy maintenance of your body,
right,
to give you the best quality of life, no matter what age and what body habits you have.
This is actually a scientific hack. It's not like something you can go out and pick in nature. This is a scientific brain hack. Okay, everybody? All right, just so you understand that. So we will have Dr. Fong on again, like I said, at 1 o'clock on the 14th, 1 o'clock on the 17th, and then we will have Dr. Fong again on the 24th, and then also December the 1st. We're going to cover a lot of topics. So if you want, go to my library and take a look at IGF1, or go to store.docofdetox.com, and all the stuff on the IGF1 is there. Go do your homework, do your research, and you'll see that what we're telling you, it shows scientific data that it helps everyone from a mother who's just trying to keep up with her children, okay, to someone working, to an athlete, or someone who's elderly that wants to feel younger and more vital. What do you think, Dr. Fong?
Absolutely. There's so many really not only well documented but very clinically proven effects that the IGF-1 can have in your body that we could literally do a year's worth of shows and probably not cover everything.
Yes. The different levels of product, you'll see them in the website. 25,000, 300,000. I mean, honestly, if you're older, I think the 300,000, and just take a few drops. Start off slowly, work your way up. If you are younger and you're not under a lot of demand, then get the 25,000. But you don't have to take the full dosage that it says on here. And I'll be honest with you, and I'm not trying to make you do this. I take what it says is take it 3 times a day with the regular dosage. Dr. Fong, you may think I'm crazy, but I take 40% more than the dosage, and I do it not 3 times a day, I do it 4 times a day. And for me, well, I don't know, I that's what I do. Okay, guys, we don't carry drugs. There's no harmful side effects. Everybody is different because everybody has different belief systems, different emotions, and different diets. Some people don't drink water and dehydrate themselves. Some people eat sugar. Some people eat flour. Some people don't food combine properly. Some people are constipated, so they're more toxic. So there it is. So we can put standard dosages, but then you've got to kick in your instinct. Am I right, Dr. Fong?
Absolutely. I mean, everybody, you can use this for such a myriad of different benefits, but if there's a specific thing that you're trying to treat with it, obviously I recommend getting hold of one of us, or seeing a physician or a provider of care that that actually understands this a little bit. But you can tailor your dosing. You can tailor the amount that you take to any specific problem in your body to help try to, again, get that critical balance back in there, get that ability for your body to help work itself through any problems, or at least keep them from overwhelming you.
Absolutely. Somebody says they can't find it. If you go to store.docofdetox.com and just put in IGF1, or put in IGF1 at the top. Somebody has a question. 1 second.
Well, can I say one more thing?
Yeah.
Oh, so one more thing I want everybody else to understand out there is that the products we're talking about, the IGF-1 products that we have here, are all in a liposomal delivery system. I mentioned that earlier. This is critical. Liposomal means it's fat-based. And guess what? These growth factors, I think I made the point earlier, there's not very much of them in the whole bottle, okay? And you need to get that into your bloodstream. But if you take it just orally and it goes right to your stomach acid, maybe digestive enzymes in your intestines, if it lasts that long, are going to destroy almost all of it. The critical way of doing this, besides putting it into an IV and putting it in your bloodstream, is to drop it under your tongue. You've probably heard people doing nitroglycerin when they have chest pain because it rapidly gets into the bloodstream. So the capillary beds under the tongue are a great place for absorption of these compounds. And using a fat-based delivery system, the liposomal delivery system, it allows for almost 100% absorption of these compounds into the bloodstream directly. So as compared to say like oral, you're lucky to get 10% of whatever you're taking in there. If again, that's in optimal conditions and you're lucky, as opposed to like greater than 90%, close to 100% absorption using a liposomal delivery system.
And that's why nobody does it. We do it. And the reality is when you put it in under your tongue, put it in and let it sit there and move it around a little bit so the enzymes are all mixing with it, and then let it stay there until you go, wow, it feels like it's just water. And guess what that means? That means that you are going to uptake it all. So you're not just going to put it in like you do with other things, okay, and just put it in and shoot it in and swallow. You're going to put it in under your tongue. You're going to hold it until you go, I don't even think there's a taste left. It just feels so watery. Because don't worry, the longer you leave it under your tongue, the more saliva is going to come in, the more enzymes are going to infuse into the product and take the product and take it where it needs to go, and bang, you get your money's worth. Dr. Fong, what do you think?
Yeah, absolutely. I mean, again, the liposomal delivery system is the critical key to the delivery of these compounds, these growth factors, into the bloodstream. Again, there being such a small amount per dose, you actually need that ability to get in the bloodstream to affect change. Mm-hmm. And I can tell you, we actually conducted an impromptu clinical study here at our clinic. We literally looked at serum levels of IGF-1 prior to taking, I think at that point we had 100,000 strength one. And we did that at the time of just before, at the time of the dosing, and we did I think increments of 15 minutes after that up to about an hour, and we saw a significant spike of the levels of IGF-1 in the blood, and it literally quickly dissipated back to physiologic or pre-dosing levels back by the time half an hour, even 45 minutes, but for sure an hour later, they were all kind of back to baseline. So your body uses this stuff up, folks. It doesn't just sit in the bloodstream.
That's why
right in your tissues, and boom.
That's why I tell everybody, like I probably do 40% more than it's on the bottle, maybe 60%. And I'm not telling you to do that. I'm not trying to get you to use lots of product. You use what your body needs, no more. It could be less than what's on the bottle, even if it's the 25,000. It could be less that's on the 300,000. Somebody else is asking here, your Ormus minerals with their electrolyte charge, can you take the Ormus minerals with the IGF-1? Well, the IGF-1, let's put it this way. I can put my Ormus minerals in everything I drink, okay, and get those electrolytes. It's different than the IGF-1, but I'm not going to mix the IGF-1 in the same glass. If you did that, you get nothing. Yeah. So when you know that you're not going to be talking just for, let's say, they say that you can do it for like even just 30 seconds, but let's say you did it for 3 minutes. Okay, now we're talking about super absorption, Dr. Fong.
So absolutely. I mean, again, the longer you keep it under your tongue on those capillary beds, the more it's going to absorb. The recommendation is a minimum of 30 seconds, but I normally try to get my patients to keep it there for about a minute or more. And again, I like the way you were saying it. You keep it there until you almost don't taste anything. So you really are absorbing everything that's in there, and you're getting it into the bloodstream.
When the fluid content under your tongue has quadrupled, you own it.
Absolutely.
That's it. You own it. You own it. And understand something. My phone number is 469-861-8884. And you can call me as much as you want, as often as you want, because guess what? Your health matters and your questions matter. I don't know if you know, but not too many doctors like me you can just call. And I will call you back. I built my life around this. This is what we do. You know, we're old school, okay? We're old school. And all we want to do is bring you back into harmony. Remember, there are no cures. There also are no diseases. There are only symptoms of a body being out of alignment. And understand something. You're going to go, well, I don't think it's, you know, all of us out here, we don't have IGF-1. Well, the reality is you could. And the other thing is, normal for me is different than the majority. The majority of the population, I don't know any 67-year-olds like me. Okay? So that's that. You decide what's normal for you. If you decide that normal is following the majority, you could be in trouble. Right? What do you think, Dr. Fong?
I couldn't agree with you more. Like I said earlier, the IGF-1 Plus products, they are the most amazing thing that you could use to not only maintain your best that you can be, your health, your lifestyle, but it could actually take you to levels where you didn't think you could do so in your particular age group or demographic.
We've got six shows on the roster. I'm going to try to get Dr. Fong to be a regular, okay? But we are going to be doing about 6 to 8 more shows, and they're going to be weekly because I've had this product for 2 years now. And because I was on the road and traveling, and also before that, we were running Extop World Healing and Training, which was a 200-room resort, which we had full the most of the time. I could not focus on getting the information of the products out. And now what we're going to do is we're going to get the information out so that people get well educated on that there is a difference between Doc of Detox products and other products and IGF-1s out there, okay? There's a big difference. And you know what? If somebody's out there and they know how to make my products better, I'm asking for you to, I'm welcoming that because it's all about that. You know, we never stop learning. We never stop growing. And you know what? The only type of expansion we want is in our mind, not in our body. Okay? Dr. Fong?
I couldn't agree more again. Again, you have to be open-minded. You have to be able to, like I tell my, if I get residents or students with me, I said, if you don't think about it, you're not going to look for it. It's the same thing with anybody. If you don't think about what you could become, you don't have that potential to think that you could be at a certain place. You're not going to look for that. Not only do you not look for that, then you're going to miss out on something here that is natural, won't cause you any harm. It's not terribly expensive at all. And the whole point is it's something that can only be a win-win for you.
Absolutely. I want to thank you for coming on today, Dr. Fong. It was truly a pleasure and an honor. So everyone, the shows won't be long, but they will be powerful. We'll give you the facts and then we'll let you know where you need to go to do your own homework and then do third-party research. Don't believe us. And then we'll see how fast you bounce back, okay? And remember something, like I said, you can call my office at 855-900-4544, extension 0. Or if you want me and you want to talk to me, you've got a question, or you have somebody that's suffering, I mean, I'll tell you the best I can and help you out the best I can. Dr. Fong, I guess we'll see we'll see you this week again.
I'm at a place called the Sierra Integrated Medical Center, and you can find us on the web at www.sierra, S-I-E-R-R-A, integrated, INTEGRATIVE.com. So SierraIntegrated.com, no dashes or spaces. Or if you're old-fashioned, you can always hit us up by phone. It's 775-828-5388.
Beautiful. Thank you, my friend.
Thank you.
And I'll see you this week.
Sounds good. Look forward to it.
Bless you.
Bless you.
Hey, everybody. Thank you. And just know that we do have the Black Friday sale on. And if you've got personal questions, even if it's not about the IGF-1, if you've got questions about anything else, please call me. You know I will call you back. If you don't hear from me for a day, you call me back anyway. And understand something, okay? Your questions matter, you matter. There's an old school thinking right now. If he's called a doctor, okay, he's going to charge you for every call. And if he's called a doctor, you got to get up and go, I'm really sorry for calling you. I apologize. No apologies, no being sorry. Talk slowly and calmly, because when people talk to my staff, they talk calmly. When they talk to me, they rush it and go really fast because they think that, they're bothering me. You're not a bother. As soon as you get rid of that, you matter, your health matters, your questions matter, okay? That will be when your life changes. You demand answers. Become a detective of your life, and know this, you haven't even started, okay, on what you could do with yourself. You have unlimited creation ahead of you, as long as you have imagination and you believe that you deserve it. So get rid of everything that you believe that you don't deserve to be well or healthy or wealthy, okay, or have what you want. You can have what you want, but you know what? You've got to allow it, and you've got to rest in it. But take massive personal action, because guess what? If you had a perfect day from the moment you rose till you went to sleep, and you knew how to think, drink, and eat, I'm going to ask you right now, what would that look like? And I'm going to leave you one other little thing here, okay? I'll be back on at 2:30 with Ola, and she is going to be teaching about light and energy and frequency, okay? And I want to leave this with you. I challenge you to do what we call a Braveheart Heroes Contract. That means tonight you're going to sit down and you're going to write all the things that you know that you should do right now to give you the life that you always deserved and the one that you want. And I want you to write that contract and put that in your car and put that on your fridge and put that on your bathroom mirror. And then I want you to look at that contract every morning and every night for 33 days, looking at it and reminding yourself of the contract and what changes do I need to make, and then watch what's going to happen. And wear a slight smile, shoulders back, connect to the Lionheart breath, and every time put a hairband on or get yourself our Braveheart Love Bands, 3, 2, 1, we got this. And every time you think of something that you don't want, that's not me. I'm letting that go. Or if you think of something and they want to terrorize you, whether it's your family or your friends or your neighbors or the news, go, guess what? That's not me. Don't believe it. And then go mind your own business and dust off your passion and purpose and then start gifting the world. Okay? So here's my little Braveheart quote for you. Okay? I am love. I am healed. I am Braveheart. Today and every day, from the moment that I rise until I gently close my eyes, I will love, respect, and honor myself first and foremost before anything else or anyone else, so help me God. Because I am, I can, I'm healed. I am Braveheart. Have a beautiful day. Bye now.